And the pharmaceutical industry did a great job at building markets for psychiatric drugs. Somewhere between 20 and 25% of Americans now take a psychiatric drug on a daily basis. That's a story of a corporate success. And if you go into our colleges, somewhere between 20 to 25% of our kids now, freshmen, arrive with a diagnosis and a prescription. And drug use is just out of control in the colleges. Now, for the health of the kids, that's a tragedy. For the kids growing up within this environment, it's a tragedy because they're being turned into psychiatric patients as kids. But from a corporate point of view, that's the creation of a market. So I hope I'm answering your question, but yes, you cannot understand this story unless you understand the profit motive. And if you go from 800 million to $40 billion in a market for psychiatric drugs in 20 years, wow, that's a success story.
No, you definitely answered my question. So how do you respond to critics who argue that your views are on psychiatric medications are overly pessimistic and that these drugs have helped many people with mental illness lead more stable lives, and fulfilling lives? How do you counter that?
That's a great question. It's very simple. What does your research show? What do NIMH-funded studies show? This is not my research. It's not my claims. I'm just the messenger here. I'm looking at what were your outcomes in the STAR-D study. 3% were well within 1 year. Now, they hid that data from the public because it was so bad, but this is what eventually came out and was acknowledged as true. What are the experts saying about the change in the course of bipolar disorder? It's gotten worse. That's their data. Martin Harrow's study, that was an NIMH-funded study to look at long-term course of schizopsychotic disorders. What did they conclude? I'm just the messenger. So the point is, this is your research. And here's the important thing is, can you show me research, rather than just complain about me, where your drugs are improving the course of depression, improving the course of bipolar disorder, improving the course of schizophrenia, improving public health outcomes, lowering the burden of illness, and they can't do it. Instead, we hear, oh, it's helped people live so many great lives. Well, okay, some people do okay on the drugs. It's true. But what are the outcomes in the aggregate, and what does NIMH-funded research show? Because it's really NIMH studies and these epidemiological studies that really bring this alive. I am just a reporter reporting on that research. And as part of what I did, I tried to see is there any research that contradicts this? Is there a long-term study that said, oh, here, the medication people are doing great, so much better than them? I can't find it. And Mad came up in 2010. I had a lot of critics. No one has pointed out a study that shows long-term benefit. And in fact, a man named Nasser Ghami, very prominent psychiatrist, recently published a paper, said, these drugs don't cure any disease. There's no evidence they provide a long-term benefit. We should be using them short-term and as low as doses as possible, which is basically what I was saying in 2010. So that's the long-winded answer to your question.
Great answer. All right, Elizabeth, where are you from and what's your question?
Elizabeth from Quebec, Canada. So very interesting conference. I was wondering if what were your thoughts on the inflammation process in the brain to generate psychiatric problems? Actually, with the increasing inflammation going on since the last 50 years and increasing psychiatric diagnosis. Also, I was wondering if it was a hypothesis to consider.
Oh, yeah. Listen, I think that's a great question. And I want to make it clear there are biological pathways to psychiatric difficulties, okay? In other words, physical health is going to often manifest, if you have illnesses, they can manifest in psychiatric difficulties, okay? And it makes perfect sense. We're mind-body machines, so to speak. Mind doesn't exist over here and the body over here. Yeah, I think this is actually... I don't think inflammation is the only cause or anything like that. But is it a pathway to psychiatric difficulties? Clearly it can be. Brain inflammation in particular, but if you have sort of a general, autoimmune responses, that sort of thing, and inflammatory triggers, that's not a healthy environment. And if people are suffering from autoimmune disorders and suffering from inflammatory difficulties, it would make sense as to why this would lead to psychiatric problems. So I think that's a great line of investigation for actually having sort of a drug response to the problems. If you can really see if someone is suffering from, say, inflammation of the brain or inflammatory difficulty, if you can somehow bring that under control with some sort of agent, that has a very good chance of helping to alleviate those problems. And there's a new book out that talks about mitochondrial functioning and all, and how once mitochondrial functioning, and I think inflammation plays a role into this, becomes compromised, you can get things like depression, et cetera. So I really believe that biological explorations are really important, and the inflammation pathway is an important one to investigate, and probably one of the most promising ones in terms of finding treatments that really help ameliorate those who are suffering in that way.
Thank you, Robert.
Thank you.
And in your book, Anatomy of an Epidemic, you argue that psychiatric medications may be doing more harm than good. What led you to that conclusion, and what evidence supports that position?
Well, I mean, first of all, the disability numbers start with that. I mean, we had this extraordinary rise in the number of people on disability due to mental illness. In 1987, which is when Prozac comes to market, there were about 1.2 million receiving a disability payment due to a psychiatric disorder. By the time in 2013, it was around 5 million people. That's a fourfold increase. But doing more harm than good, well, yeah. So, I mean, you see all these public health measures getting worse, okay? You see the burden of mental illness going worse. But also, if you're worsening the course of disorders, you're lowering recovery rates of depression, manic depressive illness, or bipolar illness, lowering schizophrenia recovery rates. That's doing more harm than good. Because even go back to Hippocrates. Hippocrates says, do no harm. Well, what he was saying is often there's a capacity to recover in nature. And if your intervention doesn't improve on that capacity to recover, you're doing harm. So let's say you have an illness where you give them, people come in, they have an illness, 50% recover and 50% stay the same. No one does worse. You'd say, the doctor, oh, I'm not doing harm. But what happens if the natural recovery rate is 80% recovered and the remaining 20% just stayed the same? Well, you've lowered your recovery rate, therefore you're doing harm. And so that is what shows in the research literature is we're lowering recovery rates, we're increasing the public health burden with psychiatric, and all this is associated with the regular use of psychiatric drugs. So that's a story of a paradigm of care, drug-based paradigm of care, that is doing more harm than good.
Great. And you just mentioned about declines in the recovery rate for people with mental illness. What are the most important factors? Are there any other factors besides the introduction of these drugs? Is it, have we taken away support? I know, like in the 80s, for example, a lot of the psychiatric institutions were closed. Is that at all, a contribution to what's going on now, or is it primarily the introduction of these drugs that aren't really working and in often cases
no, it's the whole paradigm that comes with it. Now, one of the reasons is if you believe the drugs are fixing chemical imbalances, you say, oh, well, maybe we don't need respite homes, maybe we don't need shelters, we just fix them with the drugs and we don't need to do these social supports. So that's the problem, is we put all our eggs in this basket and then we stop thinking about the environmental supports people need. So if you have a more unequal society, what do you see? You see more unhappiness, okay? What do you see among impoverished people living in poverty? Well, that's very stressful. So, and why are our kids having so much trouble growing up right now, right? What the levels? Well, you don't blame that on the kids. They're having trouble even before they get diagnosed. That's because we're not a society that's nurturing our kids in the right way. We're not providing them an environment that helps them grow up and thrive. So the drugs isolated causal problem, but they're also part of a paradigm of thinking that avoids the larger story about how do people stay well. Well, diet's important, sleep's important, meaning in life is important, social engagement is important, hope for the future is important, okay? And so we have right now clearly what happened with this paradigm of care is it put all the responsibility for the problem in the chemistry of the individual. The problem is located in you. What we really know is mental distress arises within environments, within larger social environments, and the focus on the drug focus kept us from looking at these holistic conceptions of human beings and holistic ideas of how to help people, give people shelter, meaning in life. I'll give you an example. There's a group in Connecticut. You know what they do? And most of these people have been in hospitals. It's called Volunteers for Psychotherapy. They say, we'll give you 2 hours of psychotherapy for free, or an hour of psychotherapy for free each week. You know what you have to do? You have to volunteer for 2 hours each week. So now when they volunteer, what happens? They're getting out of their house. They're no longer the one being helped. They're helping others. They now have a sense of self, of doing something meaningful, important. They're part of an organization that's, maybe it's an animal shelter, delivering food to the elderly, whatever it might be. They now have a place of meaning in life. So that's an example of where you create a new environment for a person that provides meaning, socialization, that sort of thing. Add in housing, and now you have a step towards a person building a new life. So no, it's not just the drugs, but the drugs conceptualize problems as problems within the individual, and they blind us to the thought is that we should be thinking about these from a societal wide perspective.
Great, thank you. Our next question is coming from Bin Wu. Where are you from, and what's your question?
Thank you very much for your excellent teaching. And my question is, I come from the Maryland. So question is, how important is to eat the gluten-free food for this kind of?
Well, I couldn't agree. You know, we are eating machines, so to speak. I mean, we obviously how we feel and our physical health is so tied to what we eat. And if you're eating processed foods and a lot of sugar, that's not what the body's really built to live on. I mean, you have carbs and that sort of thing. So as part of this sort of response that we should be thinking about, and you know, there's a lot of talk, there's a lot of attention being given to this, is how do we eat, how do we grow foods and raise animals that will in essence be turned into very healthy food, health promoting foods? And how do we have healthy diets? And you know, one of the things, of course, is if you go back 40 years ago, the nutrients, micronutrients that were in the food we ate was much greater than they are today because of the way we raise our, like tomatoes and everything. So in answer to your question is, this is part of what we need to do as a society is we need to, you know, eat better. And the way we can eat better, of course, is if we make a societal effort to grow our food in a healthy way and make it available. And one of the problems we have in the United States right now is good food, non-processed food is much more expensive than processed food. So if you're poor, you can get a lot of cheap carbs, which isn't good for you. But so what I'm trying to say to you is that's a great question. Food obviously is so key to our health, and health is both physical health and mental health. They go emotional health. They go hand in hand.
And I believe her question was specifically about gluten-free. Does gluten play a role?
Oh, I missed that. I'm sorry, I didn't. Listen, you know, I have a granddaughter who has celiac disease, and she eats gluten-free food. And once she got that diagnosed and, you know, started eating gluten-free, she got much better. So I think for people who can't, you know, handle wheat, obviously gluten-free is important. I don't think gluten-free is necessary for everyone. That's a larger story than anything I know about. I mean, bread has been important in human civilization for a long period of time. So it's actually interesting to me. Why are we seeing so much celiac disease today? I don't know. And I don't know if it has relation to like, has wheat changed? I just don't know. And why are our systems less able to handle certain, wheat foods? So I don't know the answer to that question is, but if something's making you sick, then it makes sense to stop eating it.
Great. Our next question is coming from Elizabeth. Where are you from and what's your question?
Elizabeth again from Quebec, Canada. In your research, did you see anything about how to taper off psychiatric medication for people who are taking it in the long term? You said that it was very difficult for those people to stop it. They would necessitate the medication for their lifetime. But did you see anything about that? About stopping the medication like slowly?
We just have 2 minutes left, Robert. Just
okay. I want to be real quick on this. Some people have difficulty coming off. Okay, some people can come off and all the different drugs, well, especially antipsychotics and antidepressants, without that much trouble. But there are many people that have very difficult times, and we're also discovering we can have what's called protracted withdrawal symptoms, and that's related to the fact of your brain not renormalizing. So now there is a lot of attention focusing on how can you taper from drugs and how can you do it successfully, and then there's models for doing it slowly. The problem is, and I have found something called the International Institute for Psychiatric Drug Withdrawal, which the purpose was to understand better what is happening physiologically, and can we develop protocols that help people get off the drug successfully, those who want to get off. And what we're finding out now is basically a spectrum of things. Some people get off okay, and actually fairly rapidly. Some people get off okay with a slow taper. Other people, they get off, but they have these protracted withdrawal symptoms that are really vexing for long periods of time, indefinite periods of time. And then there's a group of people that just can't get off, that it's just so difficult for them. So in answer to your question, there's still so much that is unknown about the drug withdrawal process, because researchers never, there was no motivation to study it, but it is being brought to attention. As I said, I helped found this thing called the International Institute for Psychiatric Drug Withdrawal. It's being recognized as a problem. But one of the recognitions is that these drugs can be a trap, and people may have real trouble coming off and getting back medication-free lives. And that should be incorporated into the risk-benefit consent process right at the beginning when you go off. But just final thing is, I don't want to leave people with a very pessimistic message saying that everybody who's on psychiatric medications will never be able to get off and resume, a drug-free life. That's not true. Many, many people get off and do well.
Great. And just with like a 10-second answer, do doctors make patients aware of the risks of going on these drugs and how it may actually make them depend on the drugs for the rest of their lives?
No.
Okay, that was a great quick answer, and I appreciate that, Robert. And with that, we come to the end of our Q&A. Robert, thank you so much for all the information that you shared. It's really important for people to know this. We can unmute the audience, please.
Thank you, Robert.
Thank you.
Robert, an amazing job.
Thank you.